So now that you know what medical gaslighting is, how do you combat it? How do you stand up to it and feel empowered when going to the doctor? In this video, I'm going to describe that. I am Dr. Felucia, and I'm a licensed psychologist. And in today's video, I'm going to be going over some ways that you can be proactive in fighting against medical gaslighting. The first thing that I would recommend is reading reviews. Nowadays, the reviews on just about anything, and you can also read reviews about doctors, medical professionals, and certain offices. And so that's something that you can do beforehand. And even though a doctor might get positive reviews, doesn't necessarily mean that you won't get gaslit, but I do recommend reading those reviews as a starting point. The second thing that I would recommend is going to the office and dressing up. So when you go to the doctor's office, dress up. You don't have to wear something ridiculously uncomfortable, but look polished, look, just dress nicely. And the reason I say this, and I talked about this in the first video, is that when you go to the doctor, there is a power differential, right? The doctor is the one in power. That's not necessarily a bad thing, but in cases when you're experiencing gaslighting, that power differential can be used against you. And so by you dressing up, it makes you feel better and it makes you feel, I would say, I mean, you know how you feel when you dress up, right? You feel competent, you feel empowered. So I would say that take the extra time to put on something that makes you feel comfortable, but also makes you feel put together and empowered. So I would say definitely dress up if you can. And then a third thing that I would say is that bring somebody with you, especially if you feel like what you're going to be discussing is something rather sensitive. You feel like if you bring somebody with you, you're going to feel more empowered, right? And so, use your discretion. But in a lot of cases, when people feel like they can bring an advocate with them, it really helps. And so, um, you know, choose this person carefully. I am aware of the unfortunate reality that a lot of people who watch my channel have experienced some type of abuse or are experiencing that. And so for some people, bringing your spouse may not be the best person, or bringing the person you're in a relationship with, because they could be a gaslighter themselves. And I know of situations where, the spouse has sided with the gaslighting doctor, and it's just awful. So pick whoever you're going to bring with you, but pick wisely. So maybe it's a trusted friend, or whoever you feel comfortable with. The most important thing is that you trust that person to advocate for you. Okay, so there's that recommendation. Another thing that I also would recommend, and I talk about this with my other gaslighting videos, is keep a journal of symptoms that you've been experiencing. When one of the most, I think, just I guess, disempowering and discouraging things to hear from a medical professional is that you are making up or imagining the symptoms that you are experiencing, which happens when you're being gaslit. And so when you have a journal and you have a list of, I experienced this symptom and reaction at this time, that empowers you. It doesn't matter if the professional doesn't believe you or not. What matters is that you feel empowered and that you have a voice. And so that helps to have that. And it also helps to have a list of questions that you want to discuss beforehand, because when you are in that medical setting, in that room, and there's just so much going on, it's very, very easy to forget the kind of questions that you wanted to ask. So come prepared with a list of questions, also very important. And then another thing that I recommend is that, if you are asking for something, maybe you're asking for a particular test to be run or a procedure to be done, and they refuse to do that, then you can say something like, I would like for you to document in my notes that I asked for this, procedure, whatever it is, blood test, whatnot, and you are refusing to do so, and please put why. Now, I want you to do this when you feel like you're just given a reason, like, I'm just not going to do it, right? There are some professionals or, some medical doctors, medical professionals that will just tell you, I'm not going to do this, instead of explaining why. You deserve to understand and know why they don't want to do something. And so if they're like, I'm not going to run it, I'm not going to do this, then say, I would like for you to document that I requested this, that you're not going to do it. And I'd also like a copy of my records, right? I'm going to need a copy of my records. Then sometimes doing that can be enough of a signal for them to reconsider that, and to understand that you are somebody who takes your health seriously and that you are playing an active role with your treatment. So, you can do that. You can also ask for a patient representative. A lot of hospitals have that in medical office, and they have somebody who's known as a patient advocate. And so if you feel like you are in a situation, you're not being listened to, you feel like you are just being, everything you talk about is just being dismissed or trivialized, you're being labeled as a difficult patient, then you can request to have a patient advocate present and say, I want to speak to them about this because I'm not happy about what is going on. And so the point of all these tips are to help you remember that you are an empowered person, right? You may not feel that way in that situation, but by you asking for certain things, by you taking notes, by you presenting yourself as somebody who is confident and educated and well informed, you help yourself see that you don't have the right to just be walked all over, just because you're not the medical professional. Okay, so I really want you to think about these tips. I know it's a lot, but think about something you could do, and it's something that you can incorporate into your regime of getting medical things addressed or medical issues addressed. Okay. And I'd love to hear from you in the comments. Have any of you dealt with medical gaslighting before? What are some things that you have done to help you? Help yourself rather, and what other things do you think could help other people? So I'd love to hear from you in the comments. If you haven't already, watch part 1, which talks about what medical gaslighting is and why we can fall prey to it. All right, so I hope you have a wonderful day that is filled with peace. If you'd like to make an appointment with me or to book a free consultation, go to my website, skillsetcounseling.com, and click on the orange button. All right, may you have a wonderful day that is filled with peace. Bye-bye.